Hello, my name is Dr. Adrian Ryan. I'm a board-certified orthopedic surgeon at Anchorage Fracture and Orthopedic Clinic. I specialize in sports medicine, primarily arthroscopy of the knee and shoulder, and also subspecialize in hip and knee replacement. In this video, I will be discussing meniscus injuries. The meniscus is a semilunar piece of fiber cartilage inside the knee. Each knee has two meniscus, one on the inside and one on the outside. The inner meniscus is called the medial meniscus, and the outer semilunar disc is called the lateral meniscus. The meniscus really act as shock absorbers, just like in a car. They take in a lot of impact forces as well as shear forces. Common injuries with the meniscus include meniscus sprains or contusions and meniscus tears. Meniscus tears generally occur with a twist and maneuver in sports, with a simple fall, occasionally with a simple twist or walk-in or bend-in. The meniscus is a semilunar cartilage that acts as a shock absorber in the knee. Certain forces can actually rip or tear the meniscus so that instead of being one solid piece of tissue, it becomes two pieces of tissue, or sometimes even more. Meniscus tears can occur with day-to-day activities in life, simple things like bending over to pick up something from the ground. They can also occur with more violent activities such as sports, basketball, football, or namely any activities that can put the knee under those forces that can cause the meniscus to tear or fail. Meniscus tears can be diagnosed in a number of ways. Some of the characteristic history of a meniscus tear includes the patient recalling simple things as bending forward or twisting and perhaps feeling a popping in the knee or a popping sensation in the knee. The patient may have tenderness along the joint line, swelling in the knee joint, or pain that is associated with bending or twisting maneuvers on a physical exam. The best way to evaluate a meniscus tear is with a magnetic resonance imaging or an MRI. This is a non-irradiation test where we can look deep inside the knee and see soft tissue and just find out if the meniscus is torn. If patients have a torn meniscus, there are a number of options available to them for treatment. If it's a minor tear and if it doesn't bother the patient too much, one option is simply just to leave it alone and to live with it. As long as the patient is not having significant mechanical problems where it bothers them too much, anti-inflammatories and activity modifications are other options. Along those lines, cortisone injections are often given for pain to give someone temporary relief of discomfort following a meniscus tear. If one is to consider cortisone injection, particularly patients who have other things going on or in their life, the injection may alleviate the pain or swelling for 2 weeks to up to 3 months or more. If the knee is very symptomatic, or if the patient doesn't like the mechanical symptoms, or if the patient has a lot of problems with the knee, then we can consider arthroscopic surgery in removing the torn meniscus or to consider a meniscus repair. If the meniscus is torn and non-viable or non-repairable, a portion of the meniscus is removed. This is what we call a partial or lateral meniscectomy, which is a short arthroscopic procedure. Otherwise, we can also consider putting stitches into the meniscus called a meniscus repair if the meniscus is felt to be repairable. Which one we choose will depend on the patient, where the tear is located, how big the tear is, and a number of other factors. Sometimes the tears are so big and so bad that we have to consider a meniscus transplant, which is another option for younger patients who need a good shock absorber for the remainder of their life. Generally, following an arthroscopic procedure in the knee, most patients will develop some degree of swelling, pain, and discomfort. Others may have some spasms, but a little bit of bruising or bleeding is not unusual in the first day or two. Patients will likely require crutches for 3 days up to 2 weeks or longer in some instances in case a meniscus tear or other procedure is completed. However, generally speaking, by 4 weeks to 6 weeks, most patients are off crutches or canes, are walking with only a mild limp, and usually would be expected to return to sports somewhere between 6 weeks up to 6 months. To learn more about meniscus injuries, please visit our website at afoc.com. Thank you.